Welcome everyone. Today we're going to be talking about walking and how it can help reduce your pain, more specifically your low back pain. You may be asking yourself, how hard could it be to walk? Well, this video is going to go over the most important aspects of walking and how you can apply specific techniques to optimize your walking today. I will be using a video analysis to go over easily correctable major mistakes that I see my patients do in the clinic. All you have to do is focus on this: hip drop, step length, trunk rotation, and probably the most important, the arm swing, or lack thereof. Walking is something we are born to do without thinking. So is breathing, but there's an app for that. Breathing apps coach how frequently you should be taking breathing breaks, along with specific techniques to optimize the depth, the length, the frequency, etc., all for your mental health. Why not treat walking in the same way for your overall physical health and well-being by optimizing your walking for pain control? This is an active treatment for your pain management plan of care that does not involve pharmaceuticals or special gadgets like massage guns, lights, and lasers, also known as passive treatments. It does not matter if it is a tendon, ligament, muscle, cartilage, or bone that is painful. Walking can help reduce the sensitivity of painful tissues. It is the weight-bearing and unweight-bearing cycles during walking that compress and decompress your joints, gently massaging them and allowing nutritious joint fluid to be released and absorbed. Overnight, the discs are decompressed and pull in excessive fluid that causes swelling, which limits comfortable spine movement in the morning. This is why I recommend walking first thing in the morning for my patients with discogenic low back pain that is worse in the morning. Walking for 10 to 15 minutes will help reduce that excess fluid. Every step compresses and squeezes old fluid out of your joints like squeezing a sponge. Every time that compression is released, it is like letting go of that same sponge, soaking up nutritious and hydrating fluid. Because cartilage is avascular, healing and growth is dependent on these compression and decompression cycles provided by walking. At the same time, your ligaments that surround your joints are gently stretched and released, which activates special nerves in your joints that respond to these oscillations of walking, increasing your threshold to detect pain. A similar mechanism is carried over to the muscles by the same joint receptors, slightly decreasing your muscle tone and tightness. Let's quickly talk about some of the changes in your spine that occur during prolonged suboptimal postures like unsupported sitting. The drawings here are two vertebrae joined by a disc known as a spinal unit. Figure B is a simplified version of Figure A, along with the addition of some important ligaments to consider. In both figures, the images on the left is a spine in a neutral position, where the compression forces are, for the most part, symmetrically dispersed and the disc easily maintains its height all the way around. The image on the right shows a forward flex spine where the compression force is concentrated asymmetrically to the front of the spinal unit. So we have compression on the front side of the spine that will drive fluid towards the back, causing the disc to lose height in the front and gain height in the back as the fluid takes the path of least resistance. This forms a wedge-shaped deformity. The extent at which this disc deformation and recovery occurs is time dependent. This means that sitting for 30 minutes will cause less deformation than 60 minutes, and so on. Your disc will also take a similar amount of time to recover its natural configuration. So, after sitting for a while and immediately trying to stand tall with a fully erect spine, you are always met with some form of resistance from your own spine. Repetitively extending and forcing your spine into this wedge shape causes microstress that can lead to pain and injury. You must take time to work your disc back to its natural conformation to avoid this repetitive microstress. This is why you shouldn't sit at your desk all day, then sit in your car for 30 minutes to drive to the gym, and then start lifting. Your disc will need to take time to decompress in the front, allowing for normal spine range of motion. This can be accomplished quicker by walking. Okay, so I've talked a lot about the disc. Now notice the ligaments that I drew in on the spine on the right. As you can see, the ligaments in the front of the spine are getting short, while the ligaments on the back are getting long. This is going to just make it that much harder for the disc to recover. Not only do the ligaments get short, they also buckle, so they can actually buckle into nerves. And a similar occurrence is happening to the muscles, where the muscles in the front of the body are getting short and the muscles in the back of the body are getting lengthened. This makes both sides of the body weak, because a long muscle is weak and a short muscle is weak. So this is not a good situation if you're trying to develop your core stability after you sit down for a long time, because your muscles also have to recover along with your ligaments and then your disc. So how do walking dysfunctions and the associated pain with them manifest? Well, some people are just unaware of their deviation. They have poor body awareness. Some people just disregard the long-term consequences of a known deviation. They just don't believe it's going to affect them. Some people do have an anatomical issue that causes them to have some sort of poor alignment or discrepancy. Some people just have poor balance, coordination, neuromuscular control, that when they're walking, they may start out correct, they may start out efficient, but then they end up having some sort of deviation later. Some people just have that poor muscle strength and endurance, or even inappropriate footwear, like high heels, flats, or their footwear is just simply old and they need to buy new shoes. Alright, so the moment you've all been waiting for, we're going to talk about these common deviations, how to spot them, how to feel them, and how to correct them so you can optimize your walking. So first we're going to talk about the hip drop. As you can see, as Barbara's walking, her left hip is pushing out to the left just a little bit, and that's causing her right side to drop down. Now, this is happening because she's not fully utilizing her left hip musculature to maintain the height of her pelvis on the right while it's unsupported. Stopping the video right here, I drew in some lines to kind of orient you on what's happening. The yellow lines represent the height of her hips. So you see that on the left, her left hip is higher than her right. The blue lines near her lower back is her pelvis. You see that the pelvis is now tilted to the right. But at her shoulders, the blue line represents her shoulder line, and it's definitely not the same as her pelvis. So what happened? Well, she made a compensation at her lower and mid back. You can see that green line starting from her lower back is tilting to the right, but then it goes straight up. This is because Barbara is now side bending in her spine to make sure that she's not just walking tilted to the right. That would be kind of awkward. So you can see how the effects of just hip drop is going to affect the joints all the way up and above it. In addition, the hip is taking some extra stress because it's pushing out to the left, therefore stretching the ligaments of the hip out and stressing the joint capsule and the joint. Okay, so here's just a quick example of myself doing the same thing. You see I have a hip drop on the right because my left hip musculature is not supporting my pelvis. I'm making up for it at my thoracic and lumbar spine just a little bit, but I didn't quite make it all the way. As you see, the blue line at my shoulders is still tilted to the right a little bit. So therefore, since my head is straight, I'm making up for it at my neck. So obviously this can cause some neck issues. I want to quickly demonstrate how this works with the left hip muscles supporting the right side of the body. As you can see here, I let my hip push out to the left, letting the right side of my pelvis drop. I'm using my left hip muscles to pull my hip back in towards the center of my body, which brings up the right side of my pelvis. Now, when you're walking, you shouldn't have the hip drop. Therefore, you want to make sure that your hip isn't pushing out to the side as you're walking, and that will most likely indicate that you're doing a good job keeping the pelvis level. So it's not about moving from a hip dropped position to a nice horizontal pelvis with the hips even. It's about trying to maintain the height that you're at, therefore decreasing the energy expenditure of your walking and decreasing the stress at the hip. So try to walk as smooth as you possibly can, like a ball rolling down a smooth hill. Now, let's talk about the next deviation, the lumbopelvic rotation. Normally, the pelvis and trunk rotate reciprocally about 5 to 10 degrees. Watch Barbara here as she is clearly rotating excessively. You can see her chest and pelvis are rotating well over the normal 5 to 10 degrees. This can happen to both the pelvis and the trunk separately or at the same time. I would say Barbara's rotating from her trunk a little bit more than her pelvis, but both are excessive. Let's stop the video for a second and see the rotations. I drew in some blue arrows to show the directions. It almost looks like she's trying to step over something on the ground as she rotates her spine to cover more ground with her step. Try it out. Pretend you are stepping over a large puddle and notice how you rotate your body to get over it. This is a pretty easy fix. For your pelvis, just shorten your step length up a little bit till it starts to feel smooth. And for your trunk, just try to keep your chest facing forward for the most part. There will be that little rotation. You can also stiffen up your spine a little bit with an abdominal brace to help with both of them. Check out my video on abdominal bracing to learn a little bit more about it, but basically just give your abs a little bit of a squeeze and a little bit of tone, and that'll help. Alright, so the next common deviation we're going to talk about is the step length. So everyone's going to have a different rhythm and will need to practice fine-tuning the length of their steps to create a smooth and efficient walking technique. Kind of hitting that Goldilocks principle where it's not too long and it's not too short, it's just right. We're going to start out with a step length that's too long. Notice how Barbara's getting her front leg locked straight and landing directly on her heel. This is an example of too long. This causes a pretty decent shock wave up her leg that is primarily absorbed into the hip. So if hip pain is your thing, you're definitely going to want to adjust this. An aggressive heel strike like this is not always present in a step length that is too long. However, it is a good indicator that something is going on. I want you guys to notice the red line between her heel of her left leg and her toes of her right leg. And this is kind of showing you the full length of the step. Next to it we have a key that says too long. That's because we're going to be adding on the too short and the just right step here in just a minute. Now fixing this deviation isn't very hard. All you have to do is shorten up your step length to the point where you do not feel your heel slamming down, you won't feel your leg locked straight, and you definitely won't feel the jarring impact whenever your front foot touches the ground. Alright, next let's talk about the short step length. As we see here, Barbara's taking very short steps. This is not necessarily bad for the hip like the long step was. However, this can be pretty stressful on the lower back as it generally shifts your body weight forward over your toes, causing you to essentially fall and bend forward. Your center of gravity is shifted forward like this. You spend a lot more time on the balls of your feet, sending a little bit more stress towards your Achilles. So if you're struggling with Achilles tendon pain or low back pain, this is something you're going to want to adjust. Furthermore, a short step length requires your arm swing to speed up, making it difficult to maintain a smooth rhythm. Again, we have the lines drawn in here. You can see that the yellow line for the short step length is far shorter than that right step length was where it was too long. Just like fixing a long step length, this really isn't that hard. All you have to do is get your step length a little bit longer till it feels a little bit more smoother and your arm swing is not spinning out of control. Alright, so now let's take a look at the optimal step length and then take a look at the optimal arm swing. So you see how Barbara's overall walk right here just looks smooth compared to the previous examples? Notice how her entire body looks stable. Her knees are straight, but they're also a little bit relaxed. Her heel's not jabbing into the ground, sending those shock waves up her legs. And her arms and legs are relatively at the same angles as they swing back and forth. Let's stop the footage and check out the length of the step compared to the others using the green, the yellow, and the red lines, along with the overall alignment of the legs and the arms, so looking at the yellow and the blue lines. You can see that the optimal step length falls right between too long and too short. The thing I want you to notice is how big of a difference there is between too long and too short. So if you fall somewhere between too long and too short, you should be okay because the difference between good compared to too long or good and too short. It's very small. So to fine tune your step length, just try to take some big steps when you're walking, then take some small steps, and then just try to find a happy medium that feels the least impactful and the most smooth. Alright, now it's time for the most important discussion, the arm swing. Let's first talk about why it's important to optimize your arm swing before we get started. Your arms act as what engineers call as mass dampers. Mass dampers are also known as energy dissipation systems, and they do just that. They dissipate energy. Engineers would say they minimize displacement of a central mass. Okay, so the fancy engineering terms are out of the way. Let's talk the applications of this concept so you can put it to use. Anatomically speaking, the spine or the torso is the central mass, and the displacement of it must be controlled to create stability. In the health and fitness world, this could be known as core stability. Basically, the force that is generated by the legs radiates up to the pelvis, the spine, and finally into the arms. Like a boxer throwing a punch, a baseball pitcher throwing a ball, a golfer hitting a ball. As famously quoted in the Happy Gilmore movie, it's all in the hips. This is because the hips transfer force produced by the legs into the spine so that ultimately it is utilized and dissipated by the arms to create the desired action of whatever you're doing. So if you do not swing the arms effectively, that force produced by the legs is never transferred to the arms and it is dissipated, therefore absorbed by the spine. This isn't necessarily a great thing for a sensitive back. This is why arm swing is so important. Try this little mental, physical exercise. Next time you take a walk, pay attention to how your arms just seem to swing on their own. This is a passive dampening. Now, are you assisting the direction of the swings with your upper body? Are you helping your right arm swing forward while you help the left arm swing backward? Well, most likely you are. This is because your hardwiring in your midbrain and spinal cord are designed to make this happen automatically. This is both the conscious and subconscious process. Some people have to work on it a little bit more than others, but this is a neuroanatomy lecture that I do not think is appropriate at this time. Don't get me wrong, it is important to focus on stability exercises that address the core. Performing planks, pull-off press, bear crawls, bridges, etc. All are great exercises in training core stability. However, the basic principles of rehabilitation should always tackle the tasks that the patient perform day in and day out first. Addressing the fundamentals is key to success. Arm swing should be the start, in my opinion, along with abdominal bracing. So while most health and fitness professionals are having you do a medicine ball twist with a lunge, I take 5 to 10 minutes of a patient's first or second visit and teach them this fundamental process of swinging their arms, and boom, done. I've just gave them something they can work on most of their day. Alright, so let's take a look at the pictures that I've included. I'm just trying to give you a couple examples of what kinds of forces your spine is resisting as you're walking. Now, these things are natural, and yes, they should be happening. They just shouldn't be happening in an excessive amount. So the picture on the left showing just kind of the legs and the squiggly line, you can see that when you're taking a step forward and you're in this kind of split stance position, you are at a short point. Whenever you bring your foot underneath your pelvis, you are now at a tall point. You're at your tallest point. So when your foot's in front of you, you're actually dropping down, and whenever your foot's underneath you, you're actually going up. So you're just stabilizing against this every single step that you take. Now look at the picture on the right. This shows the pelvis rotating. As you take a step forward with your right foot, for example, your pelvis will rotate to the left. Now, your trunk and your spine counter-rotate by basically turning to the right just enough to keep you facing forward. So there is some rotation happening at your spine, especially if you have some tight hips from sitting down all day. And then your spine has to do a little bit more rotation to make up for your tightness in your hips, creating more lower back pain. Alright, so now let's take a look at that footage again, and we'll take a look at the arms and the legs and how the angles of them should be roughly the same. So take a look at the yellow line. This represents Barbara's angle of her left arm, and the blue line represents the angle of her right leg. So these things are opposites, they're reciprocal. So the leg and the arm are going to be doing opposite directions to stabilize. If we compare those lines on the next slide, you'll see that the yellow, which is even with the arm, is slightly forward compared to the leg angle. So now this isn't bad. This is a good, this is a good margin. You want to be somewhere within this range as you're walking. So whenever you're walking and you're trying to get your arm swing and your step length just right, start to try to align your opposite arm and your opposite leg. So when you're walking forward and you're swinging your left leg forward, take a look at your right arm. Is it swinging forward at the same angle as your leg? You can kind of match those angles up. Alright, so now let's do a little comparison of what it looks like when you are not swinging your arms. So you can see here that Barbara is carrying her cell phone. Therefore, she's not getting much arm swing. You can see the blue line here is representing that arm angle, and it's essentially going straight up. And then we have the yellow line representing her leg angle, and they're crossing. So basically what this means is that as she walks and her pelvis is swinging and her legs are moving forward, all of the force is being absorbed into her spine as her spine is not rotating and her arms are not swinging. So where is that energy going? It's going into her spine. She's having to use core stability and absorb some of that force into her spine. I'm sure she's not paying attention to her core right now. So this can definitely irritate your back if you are doing something like this, whether it be pushing a grocery cart, carrying something in front of you to the side. You are losing some of that free stability, and you could possibly irritate your back. Now, this is a great exercise to carry things and work on your core stability with that intent, not while you're out casually walking around. So using myself as an example, you can see me walking on the treadmill right here. This is pretty much my optimal arm swing and my optimal step length. If we stop the footage, you can see here that I had the yellow line representing my arm on the right side, so just behind me. We did a comparison in the next video, and you can see that the yellow line again is just like Barbara's. It's a little bit inclinated, so it's pointing up a little bit more than my leg is actually going. So we have a little bit of a difference again, but it falls into that kind of optimal window for a good step length and arm swing.
Okay, so one more thing to keep in mind is that we are all different. We all have a biological envelope that we need to train to be more robust to resist injury. All of our soft tissues have a specific tolerance to carry load. If that tolerance threshold is crossed, tissue breakdown or microtrauma may start to occur. This isn't a bad thing if you do not continue the loading for that day or that week and allow for adequate tissue healing and adaptation to occur. This is the process of building anti-fragility. So remember, not everyone will have pain from walking with these mistakes today, tomorrow, next week, next month, or even next year. Maybe these people do not exceed their daily, weekly, monthly, yearly tissue capacity, and or maybe they rest long enough to recover from the breakdown process. If you are already having pain that limits you from walking, correcting these subtle variations will unload your painful tissues and turn your walking into rehabilitation that promotes healing rather than a breakdown process that creates pain. So, Microtrauma will occur if the loading cycle continues to test your tissue capacity without recovery. Microtrauma is easy to recover from. If there is any pain, it will be very low grade and it will not limit you from much for a few days, and you do not need to see your physical therapist. However, macro trauma is very hard to recover from. The pain can last for months to years, and it limits you from doing the things that you love, and you will need some assistance from a physical therapist to guide your loading dosage to help you recover. So keep that in mind. If you need to see a physical therapist, these are some of the hints that you need to go and have someone look at you and help you out. All right, everyone, thank you so much for taking your time to watch my video through the Institute of Movement Improvement, Walking, a practical and scientific guide for walking to reduce pain, not cause it. I went over the common deviations that occur during walking, the hip drop, trunk rotation, long and short step lengths, along with the arm swing or lack of arm swing. I also included some basic cues for how to start working on improving some of these dysfunctions starting today. Throughout the presentation, I focused on basic concepts like how your discs hydrate and swell overnight during sleeping, and how this can cause discomfort in the morning, and then how you can use a basic walking program in the morning to help reduce that pain and stiffness. I discussed the changes in your spine that occur throughout the day based off of the concept of spinal memory, which means that changes in your spine are dictated by your movement or lack of movement choices, and how you can use walking to help neutralize these changes. You also learned how the optimal arm swing is important in dispersing the torque generated by the legs and pelvis during walking to effectively stabilize the spine with minimal energy expenditure, and how fancy core exercises have their place in rehabilitation, but the fundamentals of walking and abdominal bracing should be prioritized first in the first few visits to supply the patients with easy tools for preventative and restorative musculoskeletal health. And remember, these walking things, a lot of people are going to say that it doesn't matter, there's no proof, there's no evidence. And that's because it's a dynamic process. There's a lot of things that go into this. It's the same thing as your grandma who's been smoking cigarettes since she was 16, and now she's 80 years old and she's not doing so bad, versus your friend in high school who's been smoking 10 years and he already had a stroke. Health conditions just affect everyone very differently. You can't simply deny that posture and alignment do not play a role in pain and dysfunction. When you go to the grocery store, I'm pretty sure you don't grab the cart that has the wobbly wheel or goes thunk, 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 because you just know that that's not very good. Or let's say you're in the rainforest and there's a bridge and you need to cross a river, and I'm pretty sure you're going to inspect that bridge for some good alignment, or you're not getting on that thing. So please, don't act like I'm some crazy person who is saying that if you walk weird for 5 seconds, you are going to have some serious pain in your knee or some stenosis in your back. That's not what I'm saying. I'm saying that we all need some sort of alignment. If there's pain especially, you gotta check these basic fundamental things out, like how things line up. Or it's just a preventative thing too. So, I'd rather take my chances and walk a little bit better with some simple techniques than walk with some dysfunctions and just to guess and see what happens later. So thank you everybody for watching. Please follow me on my YouTube and even my Instagram. The Institute of Movement Improvement.com is the website, and I will talk to you guys later.